Hands. My name is Heather Baturgic and I'm a registered massage therapist, and today's topic is going to be on diaphragmatic breathing. That's why I have my model Charlie here. I'm going to show you what's going on when you do diaphragmatic breathing, and I'm also going to teach you at the end of the video how to do it properly. If you have COPD, asthma, pneumonia, I do not recommend this type of breathing. You need to work one-on-one with a qualified therapist. This video is intended for clients of healing by hand. So if you're not personally a client, I ask that you consult your physician, physiotherapist, or massage therapist before trying any of the activities at the end of the video. In the meantime, you can enjoy the educational portion of the video. So we're going to start off with what is the diaphragm. The diaphragm is a major muscle for breathing. A lot of times when we experience stress, we tend to breathe from accessory muscles, which do help with breathing, but they shouldn't be your main uh, muscles that are causing you to breathe. So let's first start with the diaphragm. So the diaphragm attaches onto ribs 9 through 12. It's like a big balloon. So when you take a big inhale, the diaphragm blows up. So it sits in here on the end and it blows up and fills the abdominal cavity with air. And then when you exhale, all the air pushes back up and out. This also has an attachment onto L2 and L3. So on the anterior or the front portion of the lumbar spine, there's what is called these cruciate ligaments, and they attach on to the front side of the spine. So if you're not breathing properly from the diaphragm and getting a nice full breath, you're not stretching those muscles regularly, and they can actually pull on the low back and cause low back pain. There is actually another muscle called the psoas that they kind of crisscross each other. So if you're doing a lot of sitting, these muscles become short and tight and can pull on the lumbar as well. So again, you have the diaphragm on L2 and L3, and then your psoas muscles, they attach all on the front part of the lumbar here, and then onto the lesser trochanter. That's a little spot on the femur bone. So here, I'll show you on this side. So they would attach over like this. So when you're sitting all the time, your legs are flexed and they become short and tight, and then again that can pull on the low back as well. So you can see how it would be critical to get up moving throughout the day, so you're stretching your legs and doing proper breathing to help with the health of the lower back here. Okay, so a lot of people, when they become stressed, they breathe more from their scaly muscles. So those are up in the neck here. We have an anterior, a middle, and a posterior, and they attach onto the side of the neck here, and they attach onto the first rib and the second ribs in here. So when you're breathing from them, you're constantly moving those shoulders, like so that they're tightening through there, and you're causing all this tightness through the ribs and through the abdomen, because these spaces in between the ribs here, you have what are called intercostal muscles. And when you're not breathing from the ribs either, these become tight, and again can pull across the back and cause more back pain. So I'm going to teach you how to fix that and to assess whether or not you're breathing properly. So diaphragmatic breathing starts from the belly. We want to imagine that our bellies are like a nice balloon, and we want to inhale into them. So we're going to inhale for 1 count, and then exhale and let it go. So again, you may have noticed when you took your breath that your belly sucked in, and that's okay. That's just how your body's been programmed to breathe. So now it's just a matter of correcting that and keep trying. So that might be your start point for today, is trying to get that belly to expand. And it may take you several weeks, because if you've been breathing where you're always sucking your gut in, it's going to take quite a long time to correct that. So again, let's start with inhaling and exhaling. Good. And inhaling and exhaling. So when we do that, we're softening all the muscles in the abdomen here, and we're expanding that nice diaphragm is able to come down and push into the abdominal cavity. This will also help too with if you're having some constipation. It'll help to open everything up and allow everything to move more freely. The muscles in the gut can do what they're supposed to do because they're not being clamped down on. This will also trigger the parasympathetic nervous system. You have two points of the nervous system, and your parasympathetic nervous system is your rest and digest. The other one, the sympathetic, is your stress response, where your body starts releasing cortisol, and you don't know if you're coming or going. You don't really have a clear mind. You're always constantly fixated in the mind and thinking of things that may never become true, or may not even be important. So we want to trigger that parasympathetic nervous system so we can feel relaxed and calm. Okay, so coming back to the belly, inhale again, and exhale. And that's how simple it is. So the next part is we're going to go up to the ribs here. And we want to imagine that we have these bucket handles, and that we're pulling those bucket handles and we're pouring the buckets out. So whatever the content is in there, it is flushing out. So our ribs are going out to the side and expanding, allowing more air in there, more movement through those intercostal muscles here, more space for that diaphragm. So place hands on the sides of the ribs and imagine that they are opening up. So inhale and exhale. So when you exhale, your waist is kind of cinching in a bit, squeezing out all of the air. So again, inhale and exhale. Good. So now coming up to the chest, we have the sternum here, and it's attached onto the ribs by all of this cartilage up here. And so that allows movement through the chest. Otherwise, you wouldn't be able to get any air through there. I know a lot of people think this is just solid bone, but it's actually cartilage to allow the chest to open and expand. So just place a hand up here, and we want to imagine that our chest is rising up and rising out. Okay, so inhale into the chest and exhale. And you may have found that really easy because you're used to breathing more up through the neck. And when you do that, you strain the neck, you end up having neck and shoulder pain, and that's no fun. So again, inhale and exhale. So now we're going to put those three movements together for a full diaphragmatic breath. So start the belly, inhale, the ribs, and the chest, and then exhale. So now I want you to nice and fluidly move through and breathe belly, ribs, chest, belly, ribs, chest. Okay, so let's do it together. And exhale. Good. So again, inhale into the belly, ribs, and the chest, and then exhale and let it go. So I hope that this has been helpful. And just remember, it'll take some practice, especially if every time you inhale, you're sucking your gut in. Just be patient and just spend a few minutes every day. You'll find that it can be a little bit of a meditative practice as well, too, because you get in the rhythm of the belly, ribs, chest. Belly, ribs, chest. It's kind of hard to be thinking about outside things when your focus is on your breathing. So have a great day. And if you have any questions or comments, please leave them below. Thank you.